Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Nephrin molecular series or edition. This audio podcast is part of a Tornado PlexAR. This audio podcast as part of a Monster Bostics, and this audio podcast as part of a Storm Robotics production. This audio podcast is sort of a summary but also some conclusions around this published works from 2014. So the aim of the works was to highlight some of the importance of raising awareness around chronic kidney disease or CKD, and providing a sort of a perspective of how nephrologists or clinicians can prospectively enhance practices in the care for young people, and parents and guardians. And so as part of the claim, as part of the claim, as part of the claim in this works, the claim in here, a claim here was that the future prospectively clinicians are unable to sort of best practice unless they become more involved in patient-led initiatives and better appreciate how service users utilize or seek to utilize the internet, for example, as an effective element. The sort of published works also looks to inform how using social media can help raise awareness, and providing providing the RPSG and KDAR social media platform examples. And the RPSG can positively influence positively influence to gather and sort of resources to support those suffering with CKD or varying forms of CKD, and to help self care or prompt self care, and amongst those who are suffering with CKD or varying forms of CKD, again, and to enhance shared decision making, empowering them to adapt positive strategies. There is or are still ongoing challenges to provide best care for those suffering with CKD, and ultimately there is an increasing requirement to see that the strategies or the coping strategies, for example, coping strategies for young people, and for young people are more formidable, and also to highlight how using or utilizing the internet and online forums and social media platforms can be useful. As per the claim, the future clinicians in amongst pediatric nephrology unable again to develop best practices unless they get more involved in patient-led initiatives, and better appreciate how young people with CKD utilize sort of social media platforms for social media platforms. And professional healthcare professionals should also have an understanding of what additional what other resources are available for young people. And so studies are also, or investigations are also needed to understand whether, for example, internet use under supervision of healthcare professionals will improve clinical outcomes, adherence, and decision making in patients, also patients or service users. These are required in order to achieve sort of best practices for young people, in CKD. That draws this audio podcast to a close. This has been an audio podcast as part of the Nephrin Molecular Edition or Series. This audio podcast as part of a Tornado PlexAR. This audio podcast as part of a Monster Bostics. And this audio podcast as part of a Storm Robotics production.